Bye. So the difference between a lift and a reduction is basically a lift will tighten the breast, tighten the skin, move the nipple from a low place to a high place, and move the whole breast up onto your chest. And the main question you want to ask someone if they want a lift slash a reduction is, what size bra do you wear? Are you happy with that size? If you're happy with the size of bra that you're wearing and just unhappy with the shape, then it's a lift that you need. If you're unhappy with the shape and unhappy with the size, then if the size is too big, you need a reduction. If the size is too small, you might need a lift and implants. So a reduction is the same as a lift. The markings are the same. When you draw on the patient, you draw the same markings, and the landmarks and the way we work it all out is the same, or similar, except with a reduction, you are taking breast tissue out. Now, obviously, you have the nipple in the middle of the skin that you remove. That's why you can make the nipple any size you want. The nipple's often a bit big, or at least the areola. Because you're removing all the skin around the nipple and the areola, you can just remove some of the areola skin while you're doing a lift or a reduction. And when you're doing a reduction, you're removing breast tissue. So you have to keep the nipple on a stalk of tissue, but you remove all the other tissue, breast tissue from that, and you make the breast smaller as well as lifted. So if you're a G cup or a J cup or some big whatever cup, if you want to be a smaller cup, then it's reduction. So it's a similar operation. The scarring is similar. Often you're taking more skin with a reduction, although not necessarily, but so often you often need the horizontal scar, and it's often a bit longer for a reduction because the more skin you take out, the more scarring there is. And also there are more potential for complications. It's a bigger operation, basically. A reduction is more expensive. It's potential for complications. We send the tissue away for histology. So there's an expense with that, but there's also increased risk of complications. So the complications themselves are the same: wound healing problems, nipple problems, asymmetry, dog ears, but it's just a little bit more with all of the complications are a bit more with the reduction because it's a bit more of a bigger deal.